In this video, today we will see how laser can be applied for cataract surgery even in a patient who's had previous radial keratotomy. Now as we begin to start the docking, you can see the flashing red light, and around the flashing red light you can see the radial marks from previous keratotomy. Now the patient is looking at the red blinking light, and he can see that despite the cataract and the radial incisions, on the right side of the screen, you can see the imaging of cornea, and then soon the lens begin. Now, when the docking mechanism is engaged, you can put your pre-planned incisions overlay on the actual real-time picture. Here we see 6 incisions radially and 1 centrally cylinder going to be made. We are positioning it to make sure it's central to the eye and to the dilated pupil. Once this is done, we can start obtaining real images of the lens too. If you note, this time we avoided doing corneal incisions because they may interfere with the previously made radial keratotomy incisions. On the real-time imaging on the right side, you can see the cornea and the lens, and we are positioning now the anterior capsulotomy. We make sure we take the highest point and the lowest point and average it. The yellow cylinder-like object or area you see is the area where the laser is going to act within the lens. This area we pre-program it to prevent the laser going beyond the posterior capsule. Now the laser has begun and making an opening in the anterior capsule. You can see the bubbles coming to the surface, and it's interesting that radial keratotomy incisions are not interfering with this process. Now the 6 radial incisions have simultaneously begun, as has the central circular incision. And the laser is firing from down to up so the air bubbles can escape. There is hardly any discomfort to the patient, and as you see, the eye is very steady. Now the process is complete and laser tells us to release the suction mechanism. Thank you. For more information, read Pi in Eye.